Synapses. I'm Kevin. We had discussed on how to approach a dengue patient in our part 1 video. If you haven't watched it yet, make sure you watch the part 1 video by clicking the link down below the description. Alright, this video is going to focus mainly on how to diagnose dengue infection. Well, zap in. Before we jumped into the diagnostic tool for dengue, let's see what basic investigation should we order as a doctor when we suspect a dengue case. Firstly, we need to order full blood count. Obviously, full blood count is required in this patient. For dengue, mainly we are looking at the white cell count and the platelet count. Remember, we have discussed before, in febrile phase, white cell count will decrease rapidly, followed by platelet count as the disease progresses. In critical phase, platelet is particularly important to look at as it can drop drastically. In recovery phase, white cell count will normalize and followed by platelet count. Second, hematocrit. We need to be aware of the rising HCT in dengue patient because it indicates plasma leakage. The higher the HCT, the more concentrated the blood is, and this is usually seen with increase in capillary permeability and third space loss. These are the normal value of HCT among the Malaysian population that we usually refer to based on research study. Third, liver function test and Coag profile. It is indeed important, especially when the patient is complaining of warning signs like abdominal pain. Dengue can cause hepatitis, and these definitely can be picked up by doing LFT. Renal profile. Acute kidney injury can occur due to pre-renal causes like dehydration, especially when the patient has vomiting or diarrhea. Lactate and blood gases. This is to detect presence of metabolic acidosis. If cells are undergoing hypoxia due to shock, lactate will be released because anaerobic respiration will take place. Metabolic acidosis can be interpreted from the blood gas result. In severe case, you can even see Kussmaul breathing. Now let's talk about the diagnostic tests for dengue. Here is the list of possible diagnostic tools to confirm dengue infections, which are the rapid combo test, the NS1 antigen, Dengue IgM and IgG test, dengue viral RNA detection, which is the real-time RT-PCR, and dengue virus isolation. I will be discussing the common tools that we used in Malaysia to diagnose dengue because some of the tests are not available in most places and it is too expensive. The first test is Rapid Combo Test, RCT. Rapid Combo Test is so important because it can diagnose dengue within 15 to 20 minutes. It is used to detect the virus and the antibody in the same time, which means this is a combination of NS1 plus IgM plus IgG that we are going to mention later on. NS1 is the virus, IgM and IgG are the antibodies, so it has a longer detection window. Simple term, this test can help you to detect dengue fever in the early as well as the late phase of dengue. Second test is non-structural protein 1 antigen. NS1 antigen is a glycoprotein that is found in the virus, but if you use this alone, can give you a false result as other similar virus which coming from the same family, flavivirus, like yellow fever and West Nile infection can give you positive result as well. NS1 can detect dengue before day 4 and 5 and it becomes undetectable in recovery phase. Third, Dengue IgM and IgG test. The IgM and IgG, which is detected by ELISA, is mainly used to separate primary infection from secondary infection of dengue fever. Simple term, it tells you whether you are having dengue for the first time or not. IgM will have higher level if you are having dengue for the first time after day 5 and it will peaks for 2 weeks after the onset of symptoms and become undetectable by 90 days. If IgM is negative when you first see the patient, you are going to assume the patient is in day 1 of dengue fever and you need to repeat a serum IgM after 5 days because that is when the IgM start to rise. If this is not the first time you are having a dengue, which means a secondary dengue infection, IgM usually only rises after day 7 and lower in titers. For IgG, no matter you are having a primary or secondary dengue infection, it will be detected in 100% after day 7 of onset of fever. You can also use the level of IgG to differentiate between primary and secondary infection, as secondary infection will have significant raise of IgG. So if a patient comes with a suspected dengue disease and you will do an IgM test and it is negative, you will going to repeat the IgM test after 5 days. If the IgM is still negative after 5 days, you need to prove this is a dengue case and report the case as mentioned before, so you cannot leave the diagnosis hanging there. You have to repeat your IgG at day 7 of the disease because it should be positive in all cases of dengue. Dengue viral RNA detection real-time RT-PCR. We don't do it because it is not available in many places and it is super expensive. Virus isolation. We don't do it as well. Thank you for watching. If you find this video useful, remember to like and subscribe for more. Comment down below on what topics you would like to know more in the comment section and I will see you in the next video. Peace out.